What if I told you that even if you lived with chronic pain for years, there is a procedure that is drug-free, that takes only a few minutes to an hour, that could take you to essentially pain-free within a matter of a few weeks? Hello, I'm Dr. Setari. Thank you for joining us today. Today I want to talk about something that's very personal, chronic pain. It affects almost 21% of the population. That's 51.6 million people, 2 out of every 10 people you know. For many of us, it affects us even while we're sleeping. You can't even get a good night's rest because it's waking you up throughout the night. The body needs rest. That's how it refreshes itself. It's an epidemic hiding in plain sight. This is why so many people have chronic pain and they have mental issues, depression, anxiety, suicide ideation. We're talking about the addiction crisis in America with Percocet, Percodan, Vicodin. Well, many of these patients had chronic pain. That's why they were prescribed these medicines. And what did they get for it? Addiction. And tragically, some of them, death because of chronic pain. As always, I do have a possible cutting-edge technology that could help you with chronic pain. But before I discuss that, I want to talk to you about 2 very common treatments that many doctors prescribe for common pain that, as usual, are outdated, ineffective, and actually nefarious. We're talking about anti-inflammatories, Advil, Motrin, Naproxen, and steroid injections. Both of these are very common and they are terrible. Study after study after study has shown that anti-inflammatories don't really help that much in the long run. In fact, they make things worse. They slow down the healing process when it comes to soft tissue injuries, and they actually accelerate injuries like arthritis. So what's the point? And steroids. You use steroid injections and all you're doing is essentially a Band-Aid. So why are we doing this when there are clearly better treatments available? What is the alternative? Well, a fantastic alternative that has actually been around for decades is Prolo therapy. It has evolved over the decades, and now we use PRP, plasma-rich platelets, for Prolo therapy. In other words, we draw your blood, we spin it down, and use your own natural blood products to inject into injured areas to help heal the areas. You know, it's interesting, our elite athletes whose jobs pay them millions of dollars and they have to get back to work and perform have been using Prolo therapy now in order to heal their injuries. It's because it works. My own lying eyes have seen what this treatment can do for me. I was first introduced to Prolo therapy back in 2008 when I had an injury in my knee from a hiking incident. I suffered with about a 6 out of 10 pain for a year and a half. After 3 injections in 2008, my pain went away and never came back. It's now 2024. I had a patient of mine, James Sicignano. He does not mind my using his real name. James had both knees, by X-ray and MRI studies, bone on bone. I recommended that he get Prolo therapy done. That year, he ran 2 marathons back to back. So if you've got chronic pain, I urge you to seek an expert in your city, in your neighborhood, and see if Prolo therapy isn't the right choice for you. Next, we're going to do our interviews with some experts in this field who are going to share with us their opinions about mesenchymal stem cells and Prolo therapy.